Welcome to the Tech Talks Daily Podcast, where you can learn and be inspired by real-world examples of how technology is transforming businesses and reshaping industries in a language everyone can understand. Here is your host, Neil C. Hughes.
So a massive warm welcome back to the Tech Talks Daily Podcast. And one of the subjects that often fascinates me is how we view healthcare and the shift from a reactive to a proactive mindset. Because I think it wasn't too long ago where we waited for something to go wrong. We'd have a twinge, a pain, a mark on our skin, or something was wrong, and then we go to the doctors and try and get them to try and diagnose exactly what's going on and what caused the problem. Whereas now we've got smartwatches, smartphones tracking our calorie intake, the steps that we take. We can even do blood pressure, heart rate monitors, ECGs, the list goes on. And we're almost wanting to find a problem before it becomes a problem, and that much more proactive approach to healthcare. But when I read that 29% of people that currently have a chronic health condition also have a behavioural health issue as well, it got me thinking about how tech could help change some of those behavioural issues. And let's face it, we all have them. I know I've collected more than a few during my time on this tiny planet. So what if tech could help keep us on the right track? And it was at this point that I came across a company called DarioHealth, which is a software as a service company that began for diabetes management and hypertension and recently branched out into behavioural health too. And the company has a compelling combination between medical devices and software capabilities integrated with health coaching and that human touch, which, as you all know, is a big part of everything this podcast stands for. So buckle up and hold on tight as I beam your ears all the way to California so we can speak with Omar from DarioHealth. He's waiting to speak with us now. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Hi. Yes, Neil, thanks. I'm a psychiatrist by training. I spent most of the first half of my career treating folks with all sorts of psychiatric conditions. Along the way, I became, like many physicians, disillusioned by the dysfunction in our approach to care and the inefficiencies and the inequities in care. So I joined a startup trying to solve that problem in behavioral health, and we grew that company to, I guess, what you would call a unicorn. And then I left about 18 months ago to join DarioHealth, where I'm the chief medical officer. I lead all things clinical, and I've always been fascinated by behaviors, how we can help folks with chronic diseases improve what they do, form habits, change their lives. I've written a book about this. Over time, I've developed the observation that in healthcare, we really are far too paternalistic. We don't pay enough attention to what's important to the folks we're trying to help. So our dysfunctional health systems and the very perverse incentives prevent us from solving those fundamental problems. So I became passionate about solving those.
And that's one of the reasons I invited you on the podcast today. I love how the world of healthcare, medicine and technology and all those worlds collided to take you to DarioHealth, which is, of course, a software as a service company that I believe began for diabetes management and hypertension and more recently branched out into musculoskeletal and behavioural health in this year. But can you tell me more about the story behind the company? And like I said, how those worlds of technology and healthcare have actually collided?
Yeah, no, you're exactly right. So Daario was founded about a decade ago with the mission of making it easier for people with diabetes to manage their condition. The company found success early on with a direct to consumer model that, as the popularity of the solution grew, it really became apparent that to help make access easier, that the company needed to develop a business model so it could also sell the solutions to large payers, providers, employer populations. So more recently, Daario has been building out a multi-chronic condition platform that addresses the top concerns of these business purchasers of services, both with organic, but also acquired and integrated solutions for high blood pressure, weight management, as you said, musculoskeletal and behavioral health needs. And that integrated platform is really focused on more than just, say, managing the conditions. It's about helping those people change their behaviors in meaningful, sustainable ways. And the other important focus of our work at Daario as we created this multi-condition platform is that, regardless of what condition you have, the solution focuses on meeting the needs of the end user, the consumer. And that focus has allowed us to build a journey engine that's really tailored to what the users of the service need. And that's why we see that, for example, 80% of people stick with Daario after the first year. And I think that's also ultimately why we're seeing the company grow so quickly in the payer and purchaser markets, because we have a different story, one that requires us to innovate quickly and efficiently and delivers far better engagement and outcomes than we see in the marketplace.
And one of the things that really intrigues me about the company is its compelling combination of medical devices and strong software capabilities integrated with health coaching. So can you tell me more about that combination and how actually it's not just about technology here, but it's more about how all those pieces fit together, right?
Yeah, it really is. I mean, for Daario, the primary device is the phone. No question. The phone, the thing you always have with you, the thing that you always keep charged no matter what. We don't require these bulky separate devices that you see in the marketplace that require, frequent charging and large pants pockets that many people don't have. Daario does have some other medical devices that are part of a larger ecosystem that's really designed to flex to the needs of the members. And coaching, yes, coaching is part of that ecosystem. And the reason it works so well is that, as you say in your question, everything is integrated into the multi-condition platform. And all of that sits on top of a AI-driven dynamic personalization layer. And that platform, which we use to power everything about the user journey, is really where those pieces come together. So, as the member interacts with the device and the app and the coaching, all those data are being fed into the Daario platform. Then we use AI to personalize the journey according to the, very unique and challenging needs of each person. People are different. And that does include the use of human support. And so Daario can see when and how coaches need to engage and support members. The platform then prompts the coaches to engage. The tech lets them do that at scale. The coaches can see what's going on with the members. They can intervene. They can make recommendations to other programs and be that human touch. I mean, in healthcare, people need human touch, and it can be that human touch that they need from time to time. And the extra support can be, a specialist like a clinical diabetes educator. It could be a mental health therapist, and the coach can guide all that based on intelligence from the Daario platform. And these platforms, that they're only as good as their ability to deliver data and intelligence to partners in formats that those partners can consume and use. So when you look through this ecosystem out there, so most of the folks have built these large closed systems that can't be white labeled. They can't share actionable intelligence with their partners. On the other hand, Daario is really built for useful connectivity, playing well with others. And it's very sad that that's unique in the marketplace. But not only do we have the Daario Engage platform, which is like a web-based platform that our partners can use to see all the data and intelligence that coaches can use, that customers can use, but we also put the data and intelligence into the partner records at the time, at the place, the frequency, and the formats that really work for them. So taken all together, going back to your question, taken all together, those components really form a dynamically personalized journey that adapts to member needs, drives engagement and clinical outcomes, and puts the data and intelligence in the places where it's most useful.
And before you came on the podcast today, I was doing a little research, and one of the things I noticed was that data shows that 29% of people with a chronic condition actually have a behavioural health issue. And a topic that I'm very passionate about is how we've gone from an almost reactive form of healthcare, where we wait for something to go wrong, we wait for those symptoms and go to the doctor to tell us what it is, to a more proactive approach and trying to find out, change our behaviour and stop a problem before it actually occurs. But can you expand on the scale of problems that you're trying to solve with this technology?
Yeah, no, that's a great question. And yeah, behavioral health, very close to my heart since I'm a psychiatrist by background, very closely intertwined with physical health. The statistic you quoted, really just a tip of the iceberg. There's so much research that shows that poor mental health can adversely affect your physical health. It can lead to worse outcomes physically, and that physical illness can lead to worse mental health outcomes. Poor physical health puts you at greater risk of developing a mental health problem. So if for people who are living with these kinds of conditions, with chronic conditions, helping them improve their overall health requires supporting better emotional health. Another way of putting that is that mental health is health. Mental health is health. And so the way we tackle this problem at Daario, we have an integrated behavioral health solution, allows us to deliver whole person health, seamless end-to-end kind of experience. And that starts with ease of use, with convenience. So Daario members can access a wide range of proven evidence-based tailored care that supports their unique needs in a very simple and very intuitive kind of way. So we begin with an AI-enabled screening that triages and navigates our users to the most appropriate intervention, including evidence-based treatments like cognitive behavioral therapy, self-directed care, or expert behavioral coaching. And that whole experience is guided by the Daario journey engine that adapts, that responds to their overall health needs. So the coaches have visibility into what's going on with that person's mental health journey. So they can provide support and encouragement in a personalized way at the right time, with the right language, right tone, right content. And so that means the members are really given holistic support through their entire journey and really get the mental health care that they need to feel better.
And you mentioned artificial intelligence there. And if we did have a look under the hood there, can you tell me a little bit more about how that software uses AI to encourage that sustained behavior change in users? I know you told me a little bit there, but is there anything else you can expand on?
Yeah, no, absolutely. So we use it, we focus the AI really around the journey engine. And the journey engine has to do with what timing and what tone, what content, what channel, what frequency of communication you'll get from the platform and what that will look like, all the content of that within our ecosystem. And the AI really lets it personalize that. So the journey engine sits inside the multi-condition platform. And that's where we're really starting to unlock the connection between behavioral science and personalization. So, I know your listeners know that applications of AI are really only as good as the variety and the volume of the data that are used to train and validate those models, as well as the background of the experts who annotate those input data, who revise it over time. And that's where Daario really shines. We have long-term user data, up to 8 years of participation in the program. We apply that to the user journeys through an approach that we call adaptive personalization. And the concept is rooted in the idea that people change over time. So what you like today, you may not like next month. People are always changing. When you look at digital health in general, you see a lot of dropout. So if you want long-term engagement, if you want sustained engagement, you have to adaptively personalize to close off the many known exit nodes in digital health journeys. And we start with insights from our 197,000 users, and then we apply those insights to personalize the journeys. And what that means for Daario is that Daario learns the unique needs, the wants, the preferences, and the behaviors of each member. And to keep them engaged in better behaviors day to day, the journey engine optimizes how to engage that person, right? All the way down to the right tone of a message and how and when to deliver it and when to reach out and when to suggest something different versus sticking with the same thing. It also means that when we see people struggling, the engine can adapt and learn about what's different and calibrate to those changes. People want to feel understood. And the Daario approach to personalization is all about listening and responding to that person in a way that makes sense in their lives. AI approaches let you do that at scale. And we've actually validated those approaches with a couple dozen published studies, large studies with nearly 60,000 people, long-term studies. Some of our published studies are on people who had participated for 2 years or longer across a range of different chronic conditions. So you take all that together, and that's part of how we're really using AI to encourage sustained behavior change.
So the app offers remote patient monitoring and provides users with coaching and the motivation needed to manage a chronic condition. But just to bring to life everything that we're talking about here, are there any use cases that you could share just to help people listening understand how it could work in their world?
Yeah. No, I think that's a great question. So I'd say let's take a typical user, but that's the problem is there's so many differences between people and within people, not any one persona. But I can mention Nina, older, has been living with diabetes for years, generally has her condition under control as a persona. Then something in her life changes. Maybe she moves, or for so many reasons, her healthy behaviors become very inconsistent. She starts to experience really high levels of anxiety. Now, Daario can see those changes happening in her biofeedback data when she measures her blood, her increasing lack of regular testing, her self-reported data that indicates poor emotional health, changing dietary habits. And Daario's approach to personalization means the Journey Engine is going to start crafting outreach that's designed to re-engage Nina in her healthier behaviors. And for Nina, Daario sees that her health coach, Imani, is really a key channel of support. So Imani receives the intelligence from the Daario platform. She'll be guided on how to connect with Nina. For example, what tone to use, when to reach out, what to say for the best possible response. And Nina is more likely to respond and engage the more Daario's interactions are tailored to meet her changing needs. So the human touch is a very important part of this journey. That's why we train our coaches to be experts in engagement, and why we built a scalable platform that lets them help as many people as possible. So our coaches use the latest research on behavior change, on chronic condition management, and they're prepared to support our members as their lives change. And then as a result, Nina's diabetes improves, her mental health improves, she's back on target.
And I'm curious then, is the aim to reduce healthcare costs, or is it much broader and much more than that?
Yeah. So of course, always reducing cost is always a desired outcome, but that's never the only goal or even the most important. It's really about delivering the highest value care, the most efficient, highest value care. So at Daario, we've designed solutions that not only produce that cost savings if we do our job and change people's behaviors so they make meaningful changes and improve their health. And for our partners, it's really the same. Managing costs always a priority, but savings only materialize if they're meeting other key goals like improved quality, patient satisfaction, meaningful engagement, improvement in clinical outcomes. And we believe that regardless of the goal, if you focus on supporting every person's needs, making it easy for them to change their behaviors and stick with those behaviors, form habits that will have a significant impact on clinical outcomes, on their health, that lowers costs for everybody, including the cost that patients bear.
And there are so many exciting opportunities on the horizon too. If we look at emerging technologies such as IoT and 5G connections, it'll be able to give real-time data to just about anything at all. It's incredibly exciting from my point of view. But what excites you? And are there any emerging technologies that you're excited about that will help you continue to evolve and adapt too?
Yeah, no, absolutely. And many of the technologies that already exist are maturing now in ways that are going to help move the needle on a number of fronts. I think we talked about AI. AI is actually a great example. It's such a well-worn buzzword, but as we continue to learn how best to apply it, the best use cases for AI, we'll finally be able to realize the potential. For Daario, I think there's a lot of promise there in terms of training our engagement engine, not only to hyper-personalize, but also to account for bias, which I think is something that most AI-driven platforms today are not accounting for well. They're not doing a good job addressing bias. Also, I think the innovation happening to break down the data silos to help organizations share health intelligence, those are really exciting. For so long, really rich, what would otherwise be valuable data have been living in these walled off gardens. And as an industry, so many barriers have kept it that way. And now I think we're entering a phase of real integration that'll lead to tremendous progress for digital health. And that's something we're really excited about at Daario too, as we have an incredible wealth of member data that we can use to help our clients really better manage their populations.
And I appreciate you probably can't share too much, but what's next for you guys? Where do you go from here? Is there anything else that excites you about the road ahead?
Yeah, I mean, everything excites me. Look, I've always felt that paternalism, information asymmetry, those things drive very poor care. What matters to people is often far more important than what's the matter with people. So for us, I think the future is empowering people to make, health choices, giving them the best tools, the best information to do so, democratizing access to care, so that health equity can be solved. And the highest value, most efficient care can really become the path of least resistance.
Love that. And we started the conversation today talking about what inspired you on your journey to make a difference here, especially using technology. But a question I always like to ask my guests is also, what was the soundtrack that inspired you on that career? Is there a song or piece of music that has accompanied you on your journey or just helps you get your head in the zone? What would your song be and why that we can add to our Spotify playlist?
Wow. What a great question. Surprise. That's great. Yeah. I love that you asked that. And now I need to go back and listen to what your other guests have said about their songs. This is fantastic. I love this question. Okay. There are several, but you make me narrow it down to one. So I find myself going back to this song quite a bit. And the song is called Come Out of the Woods by Matthew and the Atlas. And, I think that the biggest risk as we push hard to solve the fundamental problems in health technology, the biggest risk is losing ourselves, losing touch with our own humanity, our own identity. This is a song that's really about returning to yourself, returning home. We're going to test the limits. We're going to try things. We're going to get twisted out of shape along the way. That's the nature of innovation. But that we can always make a choice to pause, take a breath, return to ourselves. Over the centuries, artists have really treated that question of what does it mean to come home in so many different ways. You have the Odyssey, you have Ulysses. This is a song that really grounds me and reminds me that who we are is just as important as what we do.
Absolutely love that choice. And even more so, the story behind it. It's one of the big reasons I asked that question. I think it really brings to life who you are, what you're about, and where you're going to. But before I let you go, for anyone that would like to find out more information about anything we've talked about today, or even contact your team and carry the conversation we started today, what's the best starting point?
Super easy to do. So you can go to our website, DarioHealth.com. You can send us an email at info@DarioHealth.com. We'd love to hear from your listeners.
Well, I love what you're doing here. And I love how the app is engaging and offering remote patient monitoring and also providing users with coaching and motivation, because I think that is something that often gets missed. And I love the role of technology and how it all integrates together. But more than anything, just thank you for taking the time and sharing that story with me today.
Thank you, Neil. Pleasure to be here.
I love how they're using software there with AI to encourage sustained behaviour change in users. And I think I could use a little nudge in the right direction sometimes. I'll be first to admit that one. But the app is offering remote patient monitoring too, and providing users with coaching and the motivation needed to manage a chronic condition, which ultimately could reduce healthcare costs too. And there are so many big talking points around this kind of technology, and I'd invite you to share them with me. So as always, techblogwriter@outlook.com. Send me a quick email. If you're more of a social media kind of person, you can connect with me on LinkedIn, Instagram and Twitter @Neil C. Hughes. And my website is techblogwriter.co.uk. Now I'm going to try and motivate myself to get off of my podcast recording chair and get some exercise, maybe take my dog a walk. I'm not feeling a run today. Maybe I need an app for that. But more than anything, just thank you for joining me. And until next time, don't be a stranger.
Thank you for listening to the Tech Talks Daily Podcast with Neil C. Hughes. Remember, technology works best when it brings people together.